the problem with only having like dinky little arms, I can't get too far away from the camera. But so I'm not going to make this a diary. It sounds like I'm making it into a diary, but there is a reason why I want to explain my colitis situation, and I have kind of done it in chronological order. In a way, that's how my brain works as well. I like to have things in date order. It's just what makes sense to me. But so I'm in hospital now. It is December 1990, and I'm put on steroids, Prednisolone, and I'm put on the highest dosage of Prednisolone. I can't quite remember, but I think I was put on 40 milligrams of Prednisolone, and that is a drug that basically allowed my body to stop attacking itself. So that's what ulcerative colitis does. Your body is attacking itself. It doesn't recognise that your bowel is part of you. But what the steroids do, they kind of dampen down the triggers that cause the inflammation. Okay. However, as a side effect of steroids is something called moon face. Now, if you've not heard of moon face, please do look it up. It's horrendous, and although it helped my symptoms, it literally made my body expand like you wouldn't even believe. My face was like, oh my god, I'm in so much mud here. It made my face expand like I was literally like a moon. And the other thing that I want to quickly show you, I don't know if I'm going to be able to show you this or not, but oh god, right, let me try and show you. Can you see those stretch marks? Okay, so those stretch marks are as a result, direct result of the steroids, and literally within a week or a couple of weeks of starting the medication, my arms, the top of my legs, my face all expanded. It was all like horrendous, and that was because of the steroids. It obviously helped keep the symptoms at bay and meant that the bleeding stopped, the symptoms stopped, and I was able to be discharged. But I was then on steroids for the next few months. Now, I returned back to university in the January, and bearing in mind I'd only started in the October, by the November I was poorly, and by December I'd been hospitalised, and then we were obviously off for a month. When I came back in January, all my new friends didn't recognise me. Like, it was probably the lowest point of my life, because up until then I'd never really considered what had actually happened, like visually what had happened to me. And I remember walking past a girl and I was like, hi, it's me, and she had to double take, and like the confusion on her face was just so, like, it's etched on my brain, honestly. And I said, it's Aisha, and she's like, oh my god, didn't recognise you. No, because I look totally different now. Anyway, I'm going to leave that element there until the next chapter. So please do subscribe. Please do let me know if you are affected by Crohn's or colitis. What have your symptoms been? Do you know somebody if you're not affected directly? Or even if you know me, like, I'd love to know whether you have been impacted because of my condition. Not impacted, but if you are aware of my story because of obviously the fact I am quite open about it, please do let me know.